how do you respond to those who say trauma is kept in the body? And that when, and that trauma shuts down the prefrontal cortex, and that doing trauma therapy as a cognitive therapy is inadequate in some way. This is a big question in the field.
That's a huge question in the field. And we still have some unanswered questions about trauma. I mean, we're only effective 70% of the time with any of our studies. Why is that, right? And I think part of that is patient match. And that's why I'm doing research right now that if you ever attend one of my talks, I'll talk about the research I'm doing to try to figure out who are the best patients for which therapy. Because it's not just about patient choice. That's huge. It's also about, there's more to it. But the trauma, we do know that the entire limbic system, the HPA axis, does run from the gut to the head. We know that, right? So yes, there are reactions, and that's why trauma survivors feel that gut. But that's also amygdala, right? Its job is to shut down that gut. But it has that churning and burning when the amygdala first fires of fear. But I think one of the issues that we have to face is that the prefrontal cortex is critical in our thinking through things, in our making meaning of things, in our having logic of things. And I hate to promote a child movie, but if you've ever gone and seen Inside Out, I encourage any of you in terms of understanding memory. It's got the most endorsement by our neuropsychiatrists than any film I've ever heard of, because it does talk about how memory is stored and how it can be sloughed off, and how repressed memory probably isn't really the right way to think about it, which was a huge issue in our field 20 years ago. And so I would say, whether you believe it's living in the gut, whether you believe it's living in the amygdala or living here, we still know we have an impaired process. We have an amygdala hijacking with an overactive fight, flight, freeze, and we have an underactivated prefrontal cortex. And in order to get even that body response under control, I've got to quiet that amygdala, because that body response is coming from that amygdala. And the best way to quiet amygdala is either go full force, making that amygdala activate, which can be very painful for some patients, or quiet it with that prefrontal cortex.